President Trump signed the One Big Beautiful Bill Act. That's what it's called, into law on July 4th. It has tax cuts, cuts to food stamps, energy policy changes, so much. It also sends into motion more than $1 trillion in cuts to Medicaid. Those cuts will unfold over years. And to be honest, it's all very complicated. Some people who get Medicaid benefits don't even know they're using Medicaid. So we asked our reporter Amy Feiereisel to break it all down for us, what the new budget law does to Medicaid in the North Country, on today's Story of the Day.
Support for Story of the Day comes from Long Run Wealth, an SEC-registered investment advisor in Lake Placid, providing comprehensive wealth management, retirement, and financial planning solutions. LongRunWealth.com. And the Devlin Inn and Suites, Lake Placid, welcoming families, athletes, and groups to the Olympic Village, offering Adirondack mountain views and dog-friendly accommodations. TheDevlinNY.com.
Hey, I'm David Sommerstein. It's Wednesday, July 9th. First up, Democratic Senator Chuck Schumer is calling on his Republican colleagues to block a bill that would claw back more than $1 billion previously allocated to public radio and television stations. It's part of a bigger $9.4 billion rescission package that would also slash foreign aid. In a video press conference today, Schumer said he believes the cuts would severely hurt parts of New York that rely on public broadcasters.
In many parts of rural upstate New York, it's the only source of news, as you know, and taking away this funding could blow a massive hole in the budgets of our upstate stations, TV and radio.
The bill narrowly passed the House last month and requires a simple majority in the Senate to go through. North Country Congresswoman Elise Stefanik and Claudia Tenney both supported the clawback in the House. Schumer is calling on Republicans in the Senate to vote no. The vote would have to happen by July 18th.
Republicans must stop their plans to decimate funding for our TV and radio stations. The cuts threaten the very existence of many of these stations and would devastate local communities in every corner of the state.
Schumer and his fellow Democrats plan to speak on the Senate floor this afternoon to protest the rescission package. North Country Public Radio is an affiliate of NPR and one of those public radio stations. We cover ourselves just like we would cover anything. No executive had input into this story. We're learning more about what's in the Republicans' massive tax and spend cuts law and how it will affect the North Country. Perhaps the biggest impact in our region will be the cuts to Medicaid, the health insurance program that covers more than 70 million Americans. Local healthcare groups and officials have warned the cuts could devastate the North Country's healthcare system. Our reporter Amy Feiereisel came on our morning show Northern Light this morning to break it all down.
Medicaid provides health insurance to low-income people. That's been true since it was created in 1965. But in 2010, the Affordable Care Act, nicknamed Obamacare, expanded that eligibility by a lot. And it got a lot of people onto insurance who previously weren't. So today, a lot of people actually aren't aware that they're on Medicaid or getting an insurance discount through expanded Medicaid. For a lot of people getting their insurance through the New York State Marketplace, they put in their information and their income, and they see plans and their prices. And they're not explicitly labeled Medicaid or showing that you're not paying the full cost. For example, some people think they have Fidelis, but Fidelis does manage some Medicaid plans. Today, according to data compiled by the Healthcare Coalition for the North Country, about 215,000 people are enrolled in Medicaid in New York's 21st Congressional District, which covers most of our region. That's 28% of the population.
So a third of the North Country. Help us break that down. Who is on Medicaid?
Yeah, a little over half of those people are non-disabled adults. About a fourth are children, and the other fourth are people with disabilities and the elderly. And a couple of other notes, Medicaid also covers the cost of half the childbirths in our region, and 2/3 of nursing home residents in the North Country are actually on Medicaid, because Medicaid starts paying for long-term care when an elderly person has spent all their life savings.
So Medicaid is a big, big part of the North Country's healthcare system. The new budget bill that Republicans passed into law cuts over $1 trillion for Medicaid over 10 years. How will they do that?
So right now, the federal government is paying the majority share of Medicaid. So part of what this law is doing is shifting more of the cost of Medicaid onto individual states. But state leaders like New York's Governor Kathy Hochul say they cannot fill that gap. A couple of weeks ago, when the governor came on this very show, Northern Light, she said $13.5 billion in healthcare funding was at stake.
When that disappears, I have to be honest with everyone. We will never be able to make that up. I need to let people know that loud and clear. Our state budget does not have the capacity to be able to offset these horrible cuts.
So if the state can't plug that $13.5 billion hole, what happens?
I spoke with Duncan Ryan Mann about that. He's a professor of economics at SUNY Empire. He's been teaching healthcare policy for over 40 years. He said the state has a couple options. One is to lower the Medicaid reimbursement rates it gives to doctors and hospitals for services, which would be a serious financial hit for them. Another would be to cut optional Medicaid services.
There's a basket of required Medicaid services that every state who has a Medicaid program has to provide. Those are basic hospitals, doctors, nursing homes, drugs, etc. But there's a lot of optional services that New York does provide and could be cut back.
That includes things like dental care, home health services, and physical therapy. But the single largest change to Medicaid, and really the largest predicted cost savings measure in the law that Trump signed last Friday, is the creation of a work proof requirement.
Well, let's dive into that a little bit more. We've heard a lot on the national news about this. Who does it apply to, and really what's the idea behind it?
So this is something Republicans have wanted to do for a while, but it hasn't passed before. The idea behind the work requirement is that adults who aren't disabled or have young children have to sort of earn Medicaid. That's by working, doing community service, or getting work training for at least 80 hours per month. In the North Country, there are 130,000 adults who fall in the work requirement category. So that 20% of our population will have to start proving every 6 months through paperwork that they're working 80 hours a month. And if they can't prove that, or if they don't file the paperwork or they do it wrong, they would lose their health care coverage.
What do lawmakers who passed or opposed this law say about the work requirements?
Republicans have said all along that the Medicaid cuts, in this law actually aren't cuts, and that the work requirements will make sure that deserving people are receiving Medicaid and root out, quote, waste, fraud, and abuse. That's a quote from Congresswoman Elise Stefanik. Democrats and healthcare advocates say something very different. They say the work requirement adds unnecessary red tape that will cost a lot to implement. It's important to note that national data shows that the majority of adults on Medicaid are already working, part or full-time. Critics also say the work requirement is really intended to kick people off of Medicaid just because of the paperwork, or that they'll have trouble proving their work, especially people who are self-employed or gig workers. Duncan Ryan Mann, the healthcare economics professor from SUNY Empire, says the overall effect will be more uninsured people and no safety net for the unemployed.
The fact that we have an employment-based health insurance system means you're one layoff away from being uninsured. 60% of the population who has private health insurance through their employer, if they're laid off, through no fault of their own, could be faced with being uninsured.
Now let's turn to the bigger picture, how these cuts and the work requirements could impact our regional healthcare system. What are local hospitals and doctors saying about this?
Yeah, so they're basically saying that any cuts to Medicaid on the state or individual level are going to hurt them because rural hospitals operate on very thin financial ice and lots of their patients are on Medicaid. Remember, 28% of North Country residents. John Ruggie is the founder of the Hudson Headwater Health Network, which has clinics on the eastern side of northern New York.
As reimbursement shrinks, what can be expected is services will shrink. That there'll be less open office hours, there will be certain services they just can't do anymore and refer you to another hospital farther away. Already, rural hospitals have very thin margins, and many hospitals are under their margin, and this could crash them.
One big factor here is timing, so when this all takes effect, because different pieces are going to phase in over the next few years, and mostly after the midterms next November. So it's going to take a while for North Country residents on Medicaid and their healthcare providers to feel these effects directly, but they are coming. The work requirement will start in January of 2027.
That's our reporter Amy Feiereisel speaking this morning with Northern Light co-host Catherine Wheeler about the effects of Medicaid cuts. We have more details and more news on our website, ncpr.org. Music today by Christopher Watts of Canton and Gretchen Kohler and Daniel Kelly of Potsdam. I'm David Sommerstein, North Country Public Radio.